Bismillahirrahmanirrahim. Assalamu alaikum. Today's program is regarding Ramadan and diabetes, and we'll discuss how diabetic patients should fast in Ramadan, what are the complications they can face in Ramadan, during Ramadan and post-Ramadan, and how they can have a normal Ramadan fasting. Today we'll discuss all these issues, and we have with us Dr. M.A. Ebrahim, who is a consultant physician and diabetologist at Tahir Medical Center and Maiman Medical Institute, Karachi. Assalamu alaikum.
Assalamu alaikum. Thank you very much, Dr. Shahid, for inviting me to speak here.
Sir, can you tell us what are the precautions a diabetic patient should take before Ramadan?
जब हम रमज़ान की बात करते हैं, let me tell you one thing here, that Ramadan is a month which is a perfect reflection of Islamic teaching.
Right.
People do talk about the fasting and the feasting at the time, but it's a month of generosity, donations, charity. And the best thing about when we talk to our diabetic patients, their willingness to accept all the challenges and all the difficulties they would like to face for the religious fulfillment. Now we all know that the world population is increasing day by day. So is the number of Muslims, something around 2 billion Muslims around the world.
Right.
And out of those 2 billion, something around 150 to 200 million would be fasting every year.
Right.
So today, with your help, we would be creating an awareness to make them fasting as safe as possible and help them, especially those people who are at high risk or moderate risk for diabetes in Ramadan fasting. And what we are going to discuss on the guidelines which have been developed in the Islamic world with the consensus among the medical fraternities and at the same time with the religious clergy. So both they go hand to hand together and make Ramadan fasting an authenticated guidelines and safe for all our patients.
So what are the risk assessment or risk factors which are associated with diabetic patients during Ramadan?
There are few risks which are very common, which we have been studying for the last so many years, and some of them worth mentioning is a very low blood sugar, hypoglycemia, high blood sugar, what we call the hyperglycemia. Then this patient, because of the fasting and regional variation in the temperature and the fasting hours, they may go into dehydration. Then there are people who are at risk of kidney diseases, may go into acute kidney failure. These people are at risk of going into a very serious condition we call diabetic ketoacidosis. They are at risk of thromboembolism. So if we don't advise them or if we don't prepare them for Ramadan fasting, then these are the possible risks which would not allow them to fulfill their religious duties.
So what is the role of primary care physician in creating awareness in these patients?
Primary physician has a major role to play. Anybody who has decided to fast, out of those 200 millions, we always expect them that they would go and see their primary care physician at least 4 to 6 weeks before the onset of Ramadan. When they go to their primary care physician, what we want them to do is they should carry out certain basic tests. And among them, the 3 monthly blood sugar, what we call the hemoglobin A1C. There is self-monitoring of blood glucose for the last few months, so that will give us an idea that what their blood sugar is doing. They must definitely do their kidney function test, urea, creatinine, and also the albumin creatinine ratio. They should check their lipid profile. They should have their ECG done. So these are the basic tests which you should do before you go to your doctor. And then when you are there to your primary care physician, we expect them to have a good history taking and a physical examination. And by those few questions which I'll just discuss and a good physical examination, he will decide that who are the patient who has a high risk patient whom we discourage not to fast, people who are at a moderate risk, or people who are at a low risk.
So what are high risk patients?
High risk patient, when we talk about them, the people like pregnancy,
Right.
type 1 diabetes are usually we consider them as a high risk patient.
Right.
Elderly populations who have a heart problems, who have a kidney problems, people who their diabetes is not well controlled, people who are suffering from diseases which we think probably would fasting would make their disease worse. These are the people, or people who are on insulin taking 3 to 4 times a day. These are the people who are at high risk, and they need to be discouraged, or else if they insist on fasting, we should help them with the Ramadan focus education.
What about kidney disease? These patients can fast or not fast?
Kidney disease is, when we say that, there are a lot of people whom we would advise against fasting, but they still, like I told you before, would insist.
Yeah.
And these are the people, like if somebody is in this kidney disease stage 3 or above,
Right.
we advise them not to fast. But from 1 to 3, with the proper advice. But having said that, let me tell you, with the proper guidance, nowadays people who are on dialysis, people in the advanced kidney disease, with a good education and good support, they do fast.
And what about intermediate risk patients?
Intermediate risk patients or the low risk patient, these are the people whom we say yes, you do fast, they can fast, and people are on oral medications, people whose blood sugar is reasonably well controlled, they do not have advanced heart disease or blood pressure, then they, and the low risk group, they definitely also can fast, but under the doctor's supervision and guidance. And this is what we are going to discuss today to help those people so they can fast safely.
What about the education during Ramadan? How to educate these people?
Once your primary care physician has decided whether you are at high risk, intermediate risk, or moderate risk, or a low risk, how would he do that? There are a few questions we expect them to ask. कि आपकी age कितनी है? What's your age? If you are above the age of 60, 65, then that's something that put you on a high risk.
Right.
What's your diabetes like? Is it a type 1 or is it type 2 diabetes? Because type 1 diabetes who are on insulin are always at high risk group.
Mm-hmm.
What is the duration of diabetes? Somebody who has the diabetes for more than 10 years, obviously they are at high risk.
Mm-hmm.
Then the important question that your primary care physician has to ask, did you fast last year?
Yeah.
And if you fasted last year, what was it like? Were you able to complete all your 30 or 29 days fasting? Did you have any problem which would make you break your fast? What happened with your blood sugar level during that period? Like somebody, do you have any heart problem? Or do you have any kidney problem that needs to be assessed? And then what your blood sugar has been in the last 2-3 months? What's your A1C has been? If it's more than 9, then you are somebody at a very high risk. Between 7 and 9, you are in a intermediate risk group, so you can fast with supervision. What's your physical activities? Now somebody whose job involves a lot of physical activities, like people working on the roadside,
Right.
there are the people who are at a high risk group.
Mm-hmm.
So your doctor need to ask few questions. If you are on insulin, what insulin you are on, how many times a day you would take the insulin, do you have, like some elderly people, they are the people who are very sort of their religious spirituality, they just want to fast come what may. Now then you need to see it. Do you have the social help? Have they got the family members who would help them? What the mental condition is like? What the physical condition is like? So those assessment of those risk would tell your primary care physician whether I'm a high risk, whether I'm at a moderate risk or a low risk. One that has been decided, high risk group, yes, individualized focused education. For the intermediate risk or for low risk patient, we may go and do and educate them in the groups.
Right.
Now when we have decided that you individual, and we think that Ramadan focused education is very important, because if you look at the last 10-year studies that have shown that people who undergo the Ramadan focused education, they are able to complete their Ramadan fast, most unlikely to have a complication like hyper or any other complication. So that's an advantage of Ramadan focus education.
And what about education during Ramadan? So how we can educate these people about the fasting and Ramadan and during Ramadan as well?
When it goes to Ramadan focus education, we divide it into 6 different groups. Self-monitoring of blood glucose, then physical activity and exercise, then when to break the fast, which is very important factor. Then you need to discuss their Ramadan nutrition plan and their hydration. Then the important other aspect is their medicine adjustment, especially the insulin and the oral hypoglycemic agent. And then we need to discuss with their family members and with them the important symptoms of hypoglycemia, low blood sugar, hyperglycemia, and how to manage them if they have those problems during the month of Ramadan.
So first we'll discuss about self-monitoring blood glucose. What is self-monitoring blood glucose and how much time we can do this in Ramadan?
When we talk of self-monitoring of blood glucose, I think it should be mandatory for everybody within moderate risk or high risk. So they need to have, we prefer that they have a glucometer. Having said that, nowadays in the Western world, in the Middle East countries, the people who can afford it, they have a other system called continuous glucose monitoring system, CGM, in which we can check the blood sugar without a prick.
Right.
Else we make use of the glucometer, we do that. Now the question, like you said, how many times in a day and what time they should be monitoring the blood sugar. But before I go on that, I must tell all the patients that checking the blood sugar by the pinprick does not break your fast. It will break your wudu, and now there are guidelines where they do allow even you can inject the insulin during that period. The timings we prefer, obviously 6 to 7 times, but you are not going to monitor that frequently. But in the initial days, yes. Best times are before iftar, after asr, and 2 hours after iftar.
Right.
Or other thing is before seher and 2 hours or 3 hours after sehri. Then the other times we prefer is something you would do it around the Zohr time, which is a midday, and maybe around 4 p.m. in the afternoon as well. These are the time, 6 time. So in the initial days when we want to adjust your dose, you want to adjust your blood sugar level, you should do it more frequently, but later days, no. Other thing is the 7th time which you would do is that can be of any time of the day when you feel unwell, when you have features which would suggest that probably your blood sugar is going low or your blood pressure is high.
What are the symptoms which suggest that the sugar is low?
Symptoms, hypoglycemia or low blood sugar is very common. And not only the family members, patient, but the other people in the community. If you are working in somewhere in the office, the people should know what happens if my blood sugar is low. Your hand start feeling tremors,
Right.
or the whole body would have the tremors. Your pulse rate would become very high. If I'm sitting in an air condition, I start sweating. I feel hungry. And you may find that I'm not able to concentrate on my work, if I'm sitting in front of the laptop or if I'm talking to my colleagues. And there is every possibility, I hope not, but people may even pass out. If you have those symptoms, even if they begin, either your family should know that probably my blood sugar is low, and this is one of the time when you should check your blood sugar.
And what are the symptoms of hyperglycemia or increased blood glucose levels?
Hyperglycemia, people think is not that common, but one thing very important, actually in Ramadan, hyperglycemia nowadays is more common than the hypo. But the events of hypo with all its symptoms is so important that we tend to concentrate more on that. Hyper मुझे कब होगा? हाइपर का यूजुअली ये कि हम जब रमज़ान में बहुत खाना खा लेते हैं इफ्तार के बाद, या हम शहरी पे बहुत खाते हैं. These are the 2 vulnerable periods. अगर मेरा शुगर बहुत होगा, then what happens? I start feeling thirsty. I start going to the washroom again and again. My mouth feels very dry, and then again I find it difficult to concentrate. Here the one important thing is, if you get pain in your tummy, if you starting to feel sick, you feel vomiting, then this is the time you should also check your blood sugar. But this is also a very sign of a sickness that people may go into a condition what we call the diabetic ketoacidosis. So this is the time not only you check your blood sugar, and if your blood sugar is high, the best thing is to go to an emergency room.
So what are the numbers on which a person can break the fast?
This is one important thing that we should remember. If any time of the day while during the fasting period, if your blood sugar is less than 80, you should not wait for anything, you should break your fast. Or if you have an associated symptoms we just discussed of low blood sugar. If your blood sugar at any time while you are on the fast, if it's more than 300, you should break your fast. So this now, who is at risk of hypoglycemia and when? People are doing an strenuous work, a lot of physical activities. Most of the hypo would occur between 3 and iftar time. 3 p.m. and iftar time, people are more at risk of going into low blood sugar. High blood sugar people are at risk immediately after 2-3 hours after iftar, because we tend to eat a lot, or maybe people eating a lot of sweet things at the sahur. Then in the first 3-4 hours they are at risk of a high blood sugar.
So how we can adjust the medications which are taken orally in diabetic patients during Ramadan?
During Ramadan, this is one of the important things that needs a lot of work by the primary care physician, by the family members. Now let's put it that way, the people who are well controlled on diet, if he or she is a diabetic, then you don't need to worry about it, just go with the guidelines and Ramadan nutrition plan. Now somebody who's on tablets, the whole idea of you going to your doctor 6 to 8 weeks before, and recently what we have been doing, we try and avoid the medication of earlier generation which put you at risk of low blood sugar or will make you put on weight. So we are using the second generation medication.
It is first and second generation medication.
Second generations was used earlier on, but that puts you more at risk of hypoglycemia. They are very long acting, and especially they could be a problem in the elderly population. New medications are there which does not create much of a problem. So your doctor should be, but let me discuss with you one general principle, or what I say is a conventional teaching, that whatever medicine you are taking in the morning, you should take it at the iftar time. Whatever medicine you are taking at night time or at dinner time, you should take it as sahur time. But then your night time dose would be reduced by half. Unless some people whose blood sugar is not well controlled or very much higher side, then we don't tend to reduce the dose of the medicine. But if the blood sugar is well controlled, then the sahur dose would be reduced by half. And that's why I said earlier on that you should, in the initial days, try and monitor your blood sugar more frequently. So either you can adjust the diet, that either you are eating too much or you are taking less medicine.
So what about insulin? How we can adjust the dose of insulin during Ramadan?
Insulin again is something very difficult. We need to educate the patient. Now there are different types. There are people on insulin once a day, twice a day, what we call the premix insulin. There are people who are taking insulin 3 or 4 times a day, which is a type 1, and young adults who are on. Now if you're on insulin, long-acting insulin like we have in our country, Lentus or Toujeo or Levemir, that insulin which is taken once a day, what we want that you take it after iftar immediately. And when you take it immediately after iftar in the initial days, like let's suppose you are taking 20 units at night time, so you would cut it down by 20%. So you will take something around 16 to 14 units. So you don't go into hypoglycemia because it's a 24-hour insulin, so you don't have a problem at iftar time. Let's suppose you are, which is a common practice in our part of the world, we use premix insulin twice a day. So whatever insulin you are doing at the breakfast, you will take it at iftar time. Whatever you are taking at night time, you will take it at a sahur time. But you will reduce the dose of that insulin. Like if you are taking 30 units of insulin at night time, so you would cut it down to 15 or 16 units at sahur time. Then you monitor the sugar, and probably your blood sugar is high. If people are on 4 times a day, what we want them, they take a plain insulin. Usually 4 times people are at 3 times plain insulin, and they are on a long acting insulin at bedtime. So they would have a plain or a short acting insulin at their iftar time, so again at the sahur time, and immediately after iftar they would take the long acting insulin. One important thing I would like to discuss here, with your permission, that you should, when you are on insulin, you should monitor your blood sugar before iftar, that is after asr time, and before sahur. Question is how to adjust the dose of insulin. So if yours pre-iftar or pre-sahur sugar is 80 or less, then you should reduce your insulin dose by 4 units. If your sugar is between 80 and 120 at both these times, you would reduce it by 2 units. If it's between 100 and 120, you will just maintain that dose of insulin, because it's a desirable range. We want pre-sahur and pre-iftar your blood sugar between 100 and 120. If at pre-sahur and pre-iftar your blood sugar is more than 140 to 160, then you increase your dose of insulin by 2 units, and if it's more than 160, you increase the dose of insulin by 4 units. So those figures less than 80, 80 to 120, 120, 100 to 120, and 120 above. So this is how you should adjust the dose of insulin by more frequent monitoring.
Many patients are on GLP-1 agonists. These are type 2 diabetic patients who are obese. So how they can adjust the dose, daily dose or once weekly dose of GLP-1?
Now most of the GLP-1 people are once a week. Only thing is, we don't want primary care physician to start the GLP-1 at least 6 weeks before. No, they should not, because it needs a dose adjustment, it needs an escalation of the dose, and then a maintenance dose. So what you should have been there on the GLP-1. If you're on GLP-1, what we want you to take your GLP-1. There are 2 different times. Either immediately once you have broken your fast, you take your weekly GLP-1, and then after your namaz and you have your meal and everything. Or what you do is, maybe you take it later in the day, after 1 or 2 hours after iftar you take it, but it should be taken at the time within 2-3 hours of the iftar.
So what is a healthy diet during Ramadan? So in seher and iftar?
I wish there's no healthy diet as far as the patients are concerned. It's always a problem. What we want in Ramadan is that it's actually a month where, if you really plan your nutrition, you can also lose some weight. So the people who are planning to lose weight, by following the proper guidelines, they can lose the weight. Your nutritional or your dietitian would help you out. Let's say that we divide that 40 to 45% of your meal would be at iftar, 40% of your meal would be at sahur, and then remaining 15 to 20% would be the 2 snacks, which would be something around after your Isha prayer or Taraweeh and at the bedtime. So now let's go to the thing, how do you go around at iftar time? The best way, what we suggest to the people, that when you break your fast, maybe at 2 or 3 small dates. Ajwa is the best dates, but they not have much sugar in it and you can safely take it. So you have a non-sweetened drink, you have a cup 2 to 3 ajwa, and maybe a small piece of fruit. You break your fast, and then what you do is you say your Maghrib prayers, and then you have your iftar dinner. Now how do you take it? We go with the concept of Ramadan plate concept. What I mean by that you take 9 to 12 inch plate and then empirically divide it into 4.
Right.
1/4 of that would be filled in with any of the proteins. So protein may be a grilled chicken, grilled fish, you have it. One for the plate would be with the fresh vegetables or maybe a fruit as well. One for the plate would be either a multigrain chapati or roti, because in our culture, or maybe a brown rice we would go. And then one for the plate you would go for it. Maybe you have a palak paneer, or you may have a dal, or you may have a gravy with a bit of a protein into it. But the best thing is you have a beans into it, legumes into it. What is the advantage of this sort of approach? None of this, what is the thing I mentioned, would have very high calories, carbohydrates, it's protein with a bit of a fat into it. So you will feel satisfied. Your blood sugar in the post-iftar period would not go high. Problem is what? Problem is our lifestyle, our eating habits. Like I said earlier on, Ramadan is a month of fasting and feasting. So the culture is, most of places in the world at iftar time, that we tend to have all the sweet drinks, all the carbonated water, all the fizzy drinks we would like to have, all the desserts and the sweet things. You would have a naan, you would have a white bread, you would have a white rice, you would have a greasy food. Please try and avoid those things which are with very high glycemic index, like processed juices and everything, which would take your blood sugar very high immediately. So those things. Other thing, the people tend to make a mistake, which is very important. We tend to eat very fast, after iftar, and we eat like anything. Now nature has got its own way of restricting you from not eating a lot. So there is a mechanism, natural mechanism, that when you start eating, the signal goes from your tummy to your brain. It takes 15 to 30 minutes. That, my dear, you had enough, stop it. But within the 15 minutes or so, we start so quickly that when we end up in eating a lot, even the signal doesn't get there, and so your blood sugar in the immediate period goes very high. Then let's go to the sahur. Again, we want sahur something around 40% of your calories. Now sahur is something where you may have to fast for 15 hours, maybe 16 hours in certain part of the world. Maybe this year I would love to go to Russia, where it's only hardly 9 hours. So fasting would be easy. But people who have a long period, long duration of fasting, we want to eat the food at your sahur which would be absorbed slowly. So that means we need to have a protein, we need to have a healthy fat, and whatever carbohydrates we take, it should be of a low glycemic index. So all this will slowly be absorbed. Your blood sugar would not go that high, and that would last for till the iftar time. Now what to eat? So you have the multigrain bread, you have a brown bread, you can eat that. You can have halim. We want you to have an egg, white of an egg, 2 white of an egg, or a 1 fried egg, or a scrambled egg, which is a very good protein. You have it. Yogurt, which is a very good fat. You have a cottage cheese, which is a very good fat. And we do allow our patient as well a bit of a paratha, and made into an olive oil with 1 spoon. That is also very slowly absorbed. So these are the things which you would take it. You may have a gravy, you may have a dal or something. So these are the things you can have in a small amount of fruit as well. Strawberries is very good, melon is very good, apple is very good. So these are the fruit that are not with the very high glycemic index. So that would be again slowly absorbed. You would not have a problem for the next 15 to 16 hours.
So tell something about exercise and physical activity during Ramadan.
When it comes to exercise and physical activities, people who are fasting, we don't recommend that during the fasting they should not subject themselves to a very strenuous exercise. But sometimes some people, labor class, they do not have a choice. That certain areas, certain regions, when it's very hot, they may have to go and work in the sun. So those people, yes, should take care, proper clothing, head covered, and try and work into as cooler environment. Maybe you don't work then beyond 12 o'clock midday. So that's the one precaution. There are people, they should not be carrying out any strenuous exercise or activities during the fasting, because this is when they are at risk of going into dehydration, and the blood pressure may become low and they become sick. But one teaching is that people who want to do an exercise, if you are saying your Taraweehs in Ramadan, so 20 Taraweehs in Ramadan would take you 1 hour.
Yeah.
And this is as good exercise for the 20 to 30 minute brisk walking. If by any chance people who don't say their Taraweeh, then we expect them that after the Isha prayer, not in between, they should go out for a brisk and walk for 20 to 30 minutes. One observations I would like to mention here, there are a lot of people, at one time even I used to do it, and there are still a lot of people, you will see them after Asr, you will see a lot of people doing the jogging and walking into the park. This should be discouraged, especially elderly people, the people who have a heart problem, the people who have a blood pressure problems. They should not be exercising before that. Other point here, Dr. Shahid, which I forgot I would like to mention, that many times the blood sugar drops before iftar, after Asr, to around 80 or 100. If your blood sugar is around 100, you cut down your physical activities. But if it drops, there are a lot of elderly people and the people who would insist that, thank you very much, I'm not going to break my fast, come what may happen. No, don't do that. Especially those people with ischemic heart disease, people who had a stroke, they should not, because we have seen a lot of people having a stroke, MIs, a lot of people have died. So you should not insist that I will not break the fast. You can always, because in Quran Allah has clearly said in Surah Baqarah, Allah intends ease for you, not the hardship. So you can make it up later dates. There are a lot of people who are traveling, they can make it up at later dates. If you are unwell, you can make it up. So don't argue, don't insist. You break your fast and we'll make it up at later dates.
With your awareness, so Ramadan has passed smoothly. Now Meet Eid has arrived. So, ab kya kare? So on Eid day.
Oh God, this is this is where the actual feasting starts. My advice to diabetic patients would be, yes, I would love them to enjoy their Eid. And even the Quran says, and even the Hadith says that you should celebrate Eid, which we all do. But then there are ways of celebrating everything in moderation.
Right.
Like if you want to have something sweet, don't take it with your meals now, you take it in between. Now I'm not restricting you to an strenuous physical activities, or maybe you do a more walking. If you are on medications, you go back straight away into your normal routine days, pre-Ramadan medications. And if you are on insulin, I think it's the best thing. Monitor your blood sugar for the next 3 days, and maybe if you need it, like we advise to a lot of people, that on days when you're not complying with your diet, or you're going out and enjoying the food with your families or in the restaurant, you take extra 4 to 6 units.
Right.
So in moderation, but yes, again, cold drinks, desserts, try and avoid it. One thing I forgot in the Ramadan, there are 2 things that need to be avoided. After iftar and even at sahri, don't drink a lot of teas and coffees. Caffeinated would make you thirsty, would make you pass more water, and would make you at risk of dehydration. The same applies with the fizzy drinks, carbonated water. These are the 2 things, carbonated water and caffeination, should be avoided or to be at minimal.
So Dr. Ebrahim, can these patients take sheer korma at Eid?
Sheer korma, yes. We, a lot of sweeteners now, artificial sweetener, we tend to use it. And I always say that everything in moderation doesn't make much of a problem. The day when I am going out for a dinner, I make sure that evening I walk a lot, come back, or check my blood sugar, or maybe next morning you get up and maybe you do a walking, extra walking, if you want to enjoy your life.
So when should these patients should visit their primary care physician after Eid?
We actually have been stressing lately more for the people to visit 4 to 6 weeks after Ramadan, or this is part of the post-Ramadan education, Eid al-Fitr, and then your post-Ramadan visit to your primary care physician. Those tests which we discussed earlier on should be carried out again. Let your doctor again have a good history. The reason why we want that will give you an idea whether your lab parameters have they gone worse, has your cholesterol gone worse, has your hemoglobin A1C gone worse. So those things that would guide you that what should I be doing next year, and your doctor need to, that probably you need more education. At the same time, this data when collected, that would help we the doctors to make the future guidelines which are more effective, more evidence-based. So in the future, more and more people would be fasting Ramadan and would be enjoying the blessing of Ramadan, which everybody would love to.
So in the last, please give some message to our viewers and patients who are diabetic regarding Ramadan.
I recommend all my patients, even on insulin, unless severe renal kidney problem or heart problem, yes, we would help you to fast, but we would like everybody should have a Ramadan education, follow it up. Their family members should be with us when we educate them, so they need to help them out, encourage, and rather than discourage all those unhealthy habits which we should not carry out in Ramadan. And if you go with their education, I'm sure you will enjoy the blessing of Almighty Allah and will be able to fulfill your religious duties, which I think every Muslim would love to do that.
Thank you, Dr. M. Ebrahim, for coming in this program.
My pleasure, please.
Viewers, as Dr. M. Ebrahim has told us that you should visit your primary care physician before Ramadan and have your risk assessment regarding Ramadan. Till next program, Allah Hafiz.